and take a few minutes just to thank you all for being here today. I know how your schedules are very, very busy, but thank you joining us today to listen to the appointee of Order of Canada, Dr. Cooper Brathwaite, and her amazing story. We are really excited and proud to be able to be here today to listen in and learn about this great inspirational journey. As an IN myself, for those of you that don't know me, I am a case manager in Bessie Nassiopoulos. I'm a new case manager for the last year here at Care Center. An IN myself and a member of Care since 2012, and very grateful member since I received immense support and success stories from all of this amazing family we like calling ourselves here at Care. I'm proud and privileged to be here today to listen to our appointee of Order of Canada, Dr. Cooper Brathwaite, recognized for extensive contributions to the field of nursing through her leadership, public policy advocacy, education, and research. Before I introduce you all to her, I'm just going to take a few minutes for a land acknowledgement, and I would like to introduce both Dr. Cooper Brathwaite and our very own program manager, Rola El-Mobadar, that will be taking over the interview. So the land acknowledgement, the land I'm standing on today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chepway, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with the multiple Mississaugas of the Chepway bands. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generations past. We also acknowledge those of us who came here involuntarily as part of the transatlantic slave trade and honor and pay tribute to the ancestors of African origin and descent. We are mindful of broken covenants, and we strive to make this right with the land and with each other. Without further ado, I'd like to thank Dr. Cooper Brathwaite for accepting our invitation from our Executive Director, Ruth Lee, that organized this. Dr. Angela Cooper Brathwaite is a past president of RNAO, co-chair of RNAO's Anti-Black Racism Task Force, and associate graduate faculty member at Ontario Technology University. She holds a PhD in nursing from the University of Toronto, a Master of Nursing from the University of Manitoba, a Bachelor in Nursing from Memorial University, Newfoundland, a Diploma in Nursing and Licensed Midwife from San Fernando General Hospital, School of Nursing and Midwifery, Trinidad, and is Fellow of the American Academy of Nursing. She has national and international nursing experience and extensive experience in leadership, nursing administration, nursing education, policy advocacy, healthcare systems, and cultural competence. She held executive leadership positions as Director of Nursing in Acute Care and Director of Nursing Education and Development at Lakeridge Health Oshawa, and President of the Registered Nurses Association of Ontario. She has taught undergraduate nursing students in Winnipeg, Manitoba, Ontario Tech University, and graduate students at the University of Toronto and Technology University. She has received academic and service awards besides being appointed to the Order of Canada just recently in 2022, she received the Order of Ontario. She has also received the Lifetime Achievement Award in Leadership and Student Membership for RNAO. She also received leadership awards in political action in 2013, nursing administration in 2011, an award of merit in 2015 from RNAO, and the University of Toronto Distinguished Alumnus Award in 2007, Ontario Public Health Association Leadership Award in Public Health 2010, Award of Excellence from the Regional Municipality of Durham in 2006. She has published numerous peer-reviewed papers in nursing journals. Her areas of research are prevention of type 2 diabetes, cultural tailored interventions, cultural competence, and systemic racism in nursing. So as you understand, extremely privileged to listen in to the extremely fascinating story she has, and I'm very privileged to have our very own program manager to proceed with the interview. Rola El-Mobadar, RN, member of RNAO, brings 24 years of broad range experience in healthcare quality, clinical informatics, and nursing education. Rola has held several positions as a professional education development consultant, professor assistant, facilitator, and quality consultant in Canada and internationally. Currently, she's acting as our program manager here at Care Center for Internationally Educated Nurses. Rola has received her Bachelor of Science in Nursing from the American University of Beirut School of Nursing, affiliated with New York University, and has worked on a medical surgical unit till 1999. During her tenure in the United Arab Emirates, Rola joined the Nursing Department, Ministry of Health and Prevention, as a quality specialist, nurse informatics team leader, and data analyst expert career path at the Ministry of Health, Institutes of Nursing, as a nurse educator and quality management representative. During this endeavor, she pursued a master's degree in quality management from University of Wollongong in Dubai, and participated as a speaker in many conferences and contributed to several symposiums related to healthcare contemporary issues. As a registered nurse, both in Canada and United Arab Emirates, Rola held several positions as a clinical instructor, assistant professor, and facilitator at several colleges and universities, including York University, Centennial College, and Humber College. Her most recent accomplishments were the development of the Nursing Informatics Competency Framework and educational and training programs for nurses and healthcare providers to sustain safe practice during the pandemic and continue serving communities in home care. Working in a multicultural environment and diversified healthcare systems, Lebanese, Canadian, and United Arab Emirates, Rola earned an in-depth philosophy about nursing education and the innovative role of the healthcare providers in an evolving and advanced era of technology in healthcare systems in a global context. Without further ado, I cannot wait to listen in to this great interview session. The floor is yours, ladies.
Thank you so much, Bessie, and thank you, Dr. Cooper Brathwaite, for actually joining us today. I can't actually say more as Bessie has introduced you with all the exciting journey and fascinating journey. I'm honored and humbled to meet you virtually and looking forward to meet you in person. I feel privileged as well to have this opportunity to learn about your fascinating journey as an inspirational, whom I look up to as well as an IEN that has been in Canada since 2010 and witnessed a lot of changes, a lot of challenges, a lot of successes. But I'm so humbled today and so privileged, as I mentioned. So I would like to start with the first question on. I don't want to limit myself to those questions, but for the time for our as well audience and participants, I know they are excited as much as I'm excited to learn from you. So being such a great inspiration to all and having achieved so many accomplishments during your nursing career, which part of this exceptional journey do you consider the most rewarding one to you, Dr. Cooper Brathwaite?
And before I answer that question, I'd like to give a preamble. I came to Canada in 1975 as a registered nurse and licensed midwife to work with the Grenfell Regional Health Services. That's the name today. It was called Grenfell Association. It was a medical mission providing healthcare services to Northern Newfoundland and all of Labrador. And I was hired to work as a midwife in St. Anthony, which is Northwest Newfoundland, as a midwife and RN. Before I came, I had my RN license to practice in the province of Newfoundland. They also provided me with accommodations where I lived. So I had a different start to maybe many other IENs because I had a place to live. I had my license to practice. I had a work permit to work. So I was not restricted in any way. So I would say my challenges, or one of my greatest challenges, is overcoming adversity. And adversity has made me a better person. It has made me stronger. And through adversity, with God's help, I am an overcomer. I've learned to overcome. And even when people deliberately try to hurt me, I learned to forgive them. So I do not carry that hurt and that anger, because I'm telling you, anger could destroy you. And I've learned to forgive people. So adversity makes me a much better person, not only for service, but how I care for people and how I care for myself.
Oh, I'm actually kind of, we jumped into all answering to this conversation. And I'm happy to hear that you gave this advice ahead of time then, and asking what advice do you give to our audience or IEN's community is like adversity made you stronger, that not to forgive, not to hold grudges or to feel angry. So that would take me again to like, what is in your journey that particularly like a person or an event that greatly impacted on your career? And
I would say the person that affected my career and my life is my mother. She's now deceased. My mother told me as a little girl, Angela, anything you set your mind to do, you can do. And I believe that. And I'll give you, it's a joke. I was leaving Newfoundland in 1981, moving to Manitoba to do my master's degree. I knew nobody in Manitoba except a Chinese family I met on campus when I was at Memorial University. And they had now moved to Winnipeg, and I wrote him and his family and said, I am coming to Manitoba to do my master's. Are you able to accommodate me for a month until I find a place to live? And they said, yes. And when I was leaving my job in Roddickton, I told all my colleagues that I was going to Manitoba. I was going to find a part-time job in the Burton Suite to work part-time. I was going to find a place to live and do my master's. And they roared, they laughed. They thought, have you ever been to Winnipeg? I said, no. Do you really know anybody in Winnipeg? No, but I'm going. So I went. I stayed with the family for a month. And in my first day on campus, the husband dropped me off on campus and he said, this is the campus. So I have to go and find my way around campus in the University of Manitoba. I did find a nursing school. I got registered and all that. And now I'm in the line at the end of the day to sign up for a course. And the gal was standing behind me. I got in a conversation with her and I said to her, I have to look for a place to live, you know, and I have to go about finding it. She said, me too. So she was from Manitoba. She was French Canadian. And she and I, Beverly, we went and we found a place to live. That's how I got my roommate. One luscious apartment. It's called Winterland, no, Summerland. Beautiful. And we moved in there. So that was my beginning. Taking that into consideration, that was my beginning. And moving from
what
one
a great beginning.
Pardon?
What a great beginning. What a great start.
So I was never afraid to go anywhere. My mother gave me that confidence. She said, anything you set your mind to do, you could do it. And I believe her. So when I got opposition or people tell me I can't do this and I can't do that, I just push it aside because my mother told me I could do it and I believe her.
Yeah, believing in oneself, and that's the kind of the model for all our IENs, and for any kind of challenges and obstacles. You just need to believe in yourself that you're gonna be there, you're gonna achieve this, and that's how Dr. Cooper Brathwaite had started, by asking just the question, how could I find myself a place? And then that's a lovely story to share. That's a great way to kind of to build those relationships as you go and move forward, that will be part and impact in your journey. So that takes me to another thing that I would like to know more and learn about. Like, I know like nurses are committed, are passionate and compassionate. And I see that with an iconic leader, you are an inspirational as well leader, that you had possessed all of these, and it reflects in the way actually you express those stories, great and inspirational. So what is one of the characteristics you believe every committed nurse should possess?
You must be compassionate. If you are compassionate, it will motivate you to care for others. It will motivate you to put yourself aside to meet the needs of people, because many times nurses have to put their own needs aside and sometimes go without lunch or breaks to meet the needs of the patients, the clients. And having compassion is one of the key. And the key to compassion is you are able to empathize with people. If you could empathize with people, you will become compassionate, because empathy teaches us to put ourselves, as I would say, in the shoes of someone else. And the Native people have a saying that goes like this: never judge a man unless you've walked 3 moons in his moccasins. In other words, if you experience what that person has experienced, you would see things from a different perspective. So empathy is the key to compassion. And then you could add all the other qualities to it.
Wow. That brings so much warmth to my heart. As a nurse myself, as an IEN, I've been a bedside nurse for, I'm a nurse myself, an IEN myself, that I have been actually practicing a bedside nursing. But to hear this from a leader, an inspirational leader as you are, it's so heartwarming to know how compassionate care and empathy would help us as well to kind of overcome challenges and to as well care for our clients and patients anywhere in the world, like where we practice our nursing career, wherever in the world. I just have actually one thing that I would like to maybe go back and at the beginning of our conversation, you mentioned how adversity was one of the things that made you stronger and helped you through the journey at the beginning. So being the co-chair of the RNA's anti-Black racism force and having done such excellent work over the years addressing anti-Black racism, especially in the nursing profession, what advice can you give our IENs? And I know, like, we continue today raising this awareness on this very special, crucial matter in Canada for equity, diversity, and inclusivity. But I'm sure there's still a lot that we'd like to know and learn from your journey and from your work and achievements in this aspect.
Well, I would say to the IENs, they need to continue to speak out. And sometimes people are timid to do that. And you need to work with other people, with interest groups. RNA has interest groups, chapters, get involved with allies. People might not look the same color like you. And I will tell you, since I've lived in Canada, I've lived with people from 14 different countries from around the globe, okay? Different race, different color, it doesn't matter. And building friendships with different people provide you the support you need to do this work. It is not a one person's job. To be able to speak out, you need the support, and not everyone is like me, because one of the things my mom had said to me before I went into nursing, when I told her I was going into nursing, she said, I would not like you to go into nursing because you're too candid, you're too outspoken, and people would not like you for doing that. And I went anyway. But mom had said that to me because she was afraid. I haven't changed that characteristic. So I will say to people what I think. Some people might not like it and some would like it, but it doesn't matter to me. If you don't like what I say, I will say it anyway. If I think it's right, if I think it's correct, if I think it's appropriate, it's not that I'm going out there to make people's lives difficult, because I have compassion for people. I will say it. If I see wrong is wrong, I will say it's wrong and I will speak out. But you need the support of others, whether they're organizations supporting you, allies supporting you, colleagues supporting you. You need that support. And we also need safe spaces to do that talking as well. And one of the things I would encourage leaders here today to make safe spaces or create safe spaces for people to speak and to get the support that they need.
What a great inspiration that to speak out while we continue to be compassionate, and also to ensure that the messages we're sending is for the sake of supporting one another in this journey and not like to put one another down. So this is again for the success of everyone and for actually making this world a better place and making our profession as well as nursing a better one. Dr. Cooper, I'm actually so thrilled and so excited to keep asking questions. And I said, I don't want to limit myself to those questions, but what is the one behavior or trait that you have seen will derail any leader in their leadership career pathway?
It's not just one, there's several. Okay. I
Definitely.
would say lack of social support. So if you're a leader and you don't have social support from your supervisor, they could make or break you. When I was in graduate school doing my PhD, we learned, and I knew many people never finished the PhDs because they did not have the support of the supervisor. It's the same in administrative role. If you do not have support from your senior administrative person, the person you report to, it could make or break you, okay? And I have seen some, they ever saying, young nurses, nurses eat the young. I have seen nurses throw, and I'm using a literal term here, throw their staff under the bus. Rather than defend and support them, they don't do that when they're in administrative role. And I will tell you, I used to take my staff with me when it was budget time. When I work at Lake Ridge, I took a group with me to meet with the CEO, to meet with the VP of nursing, so that they could learn from me and role model. I had the evidence to put when I needed additional staff. I had the evidence to support it. And I also brought my staff along with me so they could hear and see what I was negotiating for them. I always treat my staff with respect and dignity.
Definitely, they're lucky to have you as their supervisor and as their leader. And hopefully, as you send the message to all leaders and to all of us in any position we are, just to be kind and also to listen to others who are actually part of our teams or who are actually supporting the cause, especially with what's going on after the pandemic and the crisis. Like, we are all actually in need to support the profession and support the communities by having this kind of conversations and to bring a stronger leadership. Go ahead.
I would like to add two other factors as well. Pride could destroy you. People who feel that they reach to the top and they don't need other people and they don't take other people's consideration, pride could destroy you as a leader. Another factor that could destroy you is racism or envy. And people make up stories, whether, I don't know, sometimes they make them up, you wonder where it's coming from. They could undermine your confidence and really sabotage you as a leader, okay? So you could have, so it's not just lack of social support, you could have racism come in there, you could have envy, especially if you have more knowledge, skills, and ability than your immediate supervisor. That person could undermine you just because of envy. They think you're doing too much or you will accomplish too much.
Yeah.
And I had an advisor when I did my master's thesis in Winnipeg. She said to me, Angela, you're a very strong person, she says, and you should not get a supervisor who does not have as much education as yourself. She warned me, and you know why she warned me about that? She was teaching full-time at the University of Manitoba, and she was sabotaged because she had applied for the dean position. She left that position and went to work for the Ministry of Health because people used to cut off lines from a newspaper and put it on a new sheet of paper and make words, they never type it, and send it to her to undermine her. And she was a white woman, by the way. And she said to me, Angela, do not get a supervisor who has less education or experience than yourself. She said, because they will see your strength and they would undermine you. And I have learned from that. And it also happened to me.
Yeah,
okay?
Sometimes people feel threatened by our confidence, by our knowledge, by being opinionated in a way that is serving a purpose and a cause and a bigger actually kind of strive in this world. Like there is much more to just envying, because they see in that you're actually kind of shining where others cannot actually be part of this great success and achievement. Shall I move forward, Bessie? Is there anything you would like to say or add? Or
We do have Dr. Grinspan here raised her hand. I don't know if we want to give her the speech too. I have so many IEM leaders here. I don't know
it's
where
our
to
pleasure.
begin.
Look at us. We're so humbled and privileged today to have so
Very
many
true.
leaders on this call, inspirational and sharing successful stories.
Very true.
Dr. Doris.
Grinspan.
Thank you. I just, first of all, I want to say I'm an IEM too, and one with accent. And I am the proud nominator of Angela, both for the Order of Ontario, the Order of Canada, and the American Academy. And she forgot to say one thing that is important. Angela has spine, courage. Angela has spine and has character to stand for what she knows to be the truth in any issue. I know Angela from the time we were together in the board decades ago. She has spine to stand, and she said it, whether people like it or not, which is important, because she doesn't just blur things because of whatever is the latest fashion of the day, but she blurbs what she knows to be true and what's in her heart and what she can stand for. And not everybody has, and I think it's a huge trait if you look amongst leaders that are out there putting themselves out there, you will see that they have in common values-driven lives, not just work, and that have the courage that Angela has shown throughout her entire career, and that is one of the key reasons that I nominated her, not only because of all the accomplishments. Many people have accomplishments, but not many people have the characteristics she has. So Angela, more and better every day for you.
Gracias, Madam.
Thank you so much, Dr.
And I do.
You're muted.
I do appreciate that Angela mentioned, because it would not be as appropriate for me to do, the involvement with Ateneo. Angela has been, that's the other piece that she has. She gives. She didn't speak about her community life and what she does with children in her church and et cetera. But Angela has been in Ateneo committed. It's like Betsy. I can think of Betsy like that, and a few other members that is in their blood, it's in their bloodstream. The commitment and the giving and the selflessness and the courage. So I'm going to shut up because it's her day. But not only her day, but Roland, not only her day for answering questions, to celebrate her.
100%. Thank you for mentioning this, Dr. Doris, and thank you for all the great things that you mentioned about Dr. Angela Cooper and about her kind of contribution to the community and to the profession as well. So on that note, I want to actually celebrate as well the extreme value and contribution to the society supporting Canada's healthcare system, Dr. Angela Cooper Brathwaite. What do you do to ensure your leadership growth and development? I know, like that's like can go on and on this, but that's not to be limited. But just to give this inspirational kind of steps to our IENs, to our audience who are looking up to you as much as I am today, as much as you touched me, I know you touched the souls of others today as well.
I say continue learning. When you stop learning, you stop growing, okay? Find a mentor, somebody who could help you to expand your knowledge and skill in another area. And I would like to just look for opportunities for growth and development. And I'll just share some things from my own career. When I came to Canada, I came with not a bachelor degree, but with a diploma as an RN and a diploma in midwifery. And I met a physician in Northern Newfoundland in 1975, and he said to me, why don't you do a degree? Why don't you apply to Memorial? So I listened to him and I said, okay, I'll do that. I applied to do the degree. And when I went there, they said, oh, you have a lot of clinical experience, but you're doing a nursing degree, you must have some other clinical experience because this is a nursing degree. So they said, choose something you want to do. And I chose mental health. So for 1 year, I did mental health at 3 different hospitals. So I was able to increase my knowledge and my ability in another specialty that I was able to use later on in my career. When I did my master's degree, I did my master's degree, I did the thesis in maternal child. I did the major in community health and a minor in education. So I always look for opportunities to expand my knowledge and never limit it. And on Sunday, I was talking to one of my mentees, and I said to her, she's now doing her master's, and I said, are you doing a thesis? No, I'm just doing my major in leadership. I said, you need to do research. It will open other doors. You should not limit yourself. And sometimes we go to school and we limit ourselves. Yes, it involves hard work, but open other doors by looking at other alternatives to enhance what you have or to expand what you don't have.
What? Wow, I'm actually speechless. I'm somebody who would always say we are like lifelong learners. We keep on learning and learning. And this, I'm gonna take it to my heart, because I am actually seeking opportunity for myself. And I always ask others as well the same. Where is an opportunity to grow your experience and your knowledge and to expand it? I will add my voice to you, Dr. Angela Cooper-Brathwaite, and really thank you. I don't know, I don't want this conversation to end. I want to keep asking. So I will get to my last 2 questions, which I think everything was covered is related and all together, but still I want to learn more and more from and take more from your wisdom, from your aspiring and inspiring journey. So through our very special and heart-to-heart conversation today, and inspiring our distinctive audience and special audience, we are all captivated with your stories, with your, I would say, with your limitless advice to everyone. So is there a key skill that all nurse leaders should develop in today's environment? It's very kind of a fast-paced environment. It's a very changing and non-stop, no status quo in this world and environment in healthcare. So is there a key skill that all nurse leaders should develop, and you would like to share this with them?
Well, I think besides being courageous, they need to be flexible, because things are constantly changing. And if you are flexible, you'll be able to adapt and adjust, okay? You need to develop that. You also need, again, you bring back your compassion too, your courage, your flexibility, your willingness to learn, your willingness to open and listen to what people say. And I always say to managers who have to coach them, if you ask your staff for input, do something with that information they share to you. Do not ask people for input, or if it's you're dealing with patients, do not ask people for input and then do nothing about that input. And there are times you might not be able to use all the information they share with you, but you need to go back and tell them how you use what they shared with you. Otherwise, don't ask. I know people, managers, leaders ask staff for information and they do nothing about it. Don't do it for lip service. Be intentional, how you're going to use that information, even if you use part of it or add to it. And always listen. And I'm talking to you for those EANs, just a little sip of water here. I would say to those, oh, I'm gone. I hope I could come back. Let's see here.
Yes, I think we're back, and I'm sorry about the interruption. It's part of the technical difficulties we discussed
Okay.
earlier. Sorry about that
But
interruption.
can you hear me?
We can, yes.
Yes.
But I can't see you. Anyway, I would say to nurses, listen to your patients. For those of you who are leaders, listen to your staff or the people who report to you. Those who are working at the bedside, listen to your patient. Remember, the patient is the one having the experience, and your staff who report to you, they provide different perspectives, and they could teach you, and you could apply what you hear from them in the situation to make it better. So do not limit the people who have so much to offer you.
Thank you so much. Again, I don't know, like there's nothing much that I could add to say that value the input of others and also let them feel that they are part of this, whatever is the their input is in, that to see that it's there, it's been listened to, it's been valued, and it's been taken into consideration while we're doing anything, changing a process, moving forward for policy change, anything that would support, and they put an input in, they should be actually kind of considered, recognized, and being valued as well. Thank you again and again. And I would actually, it's hard for me to believe that our interview time is like coming to an end, but it's never an end, because we're gonna actually ask you to come and share more and more every time with us. And I see like everybody like share this with me. They wanna hear more of those stories and get inspired. So what advice do you give to IENs starting their journey in Canada? I know there's a lot has been done and changes have been actually there, but still the start is so difficult to all IENs. So what advice do you give to IENs starting their journey in Canada, and for those IENs pursuing to advance their careers into leadership position for the first time in Canada?
For those who are starting, you need to be flexible and open to learning. I would say to encourage, to find a mentor to support you, somebody who could teach you something that you don't know and you would like, and be very flexible. If you're flexible, you are able to negotiate many things or even tolerate many things. Flexibility is so critical. And finding a mentor to educate you or to support you in what area you would like to develop. Continue to learn, be open to learning, and you could learn from a child, okay? Some of us don't realize we learn from children. We learn from one another, be open. And also too, for those people, I would say join an organization like RNU. It has a lot of opportunities for learning. I remember when I used to supervise students in the clinical practice, all the students who were in clinical practice with me, I used to invite them to go to the MPPs with me. I took many students to the MPP offices with me so they could learn and they could be mentored. Do some volunteer work. You know, sometimes people limit themselves. You develop a lot of knowledge and skills from doing volunteer work, and those are transferable skills that you could transfer into any job. So do not limit yourself. I know some people are coming, they might have children and they have family to balance, but look for opportunity where you could further grow and develop. And volunteerism is a great way to expand your knowledge and skills beside your learning in academic setting. And for those who want to go on to leadership roles, I would just add to that what I say to these people just starting. Sometimes you want a leadership job. It might not open up where you are. If you were to go to a place that is semi-isolated or isolated, you will get a leadership job. You will get lots of experience. And if you do 2 or 3 years there, when you come back to the city, everybody will want to hire you, okay? So flexibility is critical. And I will tell you, my first administrative job is I was working for Grenfell Regional Health Services. After I finished my university, every summer I worked for them anyway. And after I finished university, I went back to work for them full time. And they said to me, my supervisor said to me, I want you to go up to Labrador because at the nursing station up there was a cottage hospital. The director is going to close the hospital. She does not have enough staff for the summer. So I just finished, graduated in the spring. So I went to Labrador, Northwest River, a small community. It's an indigenous community. And of course, didn't have many midwives. And it wasn't a large place, but I worked there for 6, 7 months. And she said, when you finish up there, I want to send you to be the regional manager for a health center, which provided services for 7 other communities beside the one where this center was. So I spent 6 months in Northwest River. And after that, I came back and I went to Roddickton. And when I went to Roddickton, there I was. I had 26 staff. I was the only midwife. So part of my job was to do administration part of the week. And part of the week, I did clinical practice. And plus, I delivered all the babies, provided postnatal care, prenatal care. And that's when I opened up a clinic for well women because the women came at odd times during the week. And I determined, no, all the women who needed health care should come at a specific time. Those who are pregnant, those who are postnatal, those who want annual checkup. So I organized a well woman clinic to provide service for those women, and that made a difference. And I will give you one story, what happened to me when I went there. Like I said, Grenfell Regional Health Services provide accommodations for all the staff because they hire people internationally. When I arrived there, the apartment that was assigned to me was occupied by a public health nurse. She was a Newfoundlander. And the only reason she was living there because the former manager had a home in that community, but she refused to vacate. So I lived in the health center for a few months. And one evening the mail came. And by the way, when you live in the health center, we kept people for 24 to 48 hours, okay? So I was never away from my job. In the evening, my staff, if they had a complex problem, they will come and talk to me about it. I was never away. And one evening we were having supper and I got a letter from a colleague who was living in St. John's. And when I opened the letter, a slip of newspaper fell out of this letter. And then it says, foreign accent could give you a job with Grenfell Regional Health Services. And then it went on to say that Grenfell had given me her apartment, the staff apartment, and took it away from her. And she said other things, okay? And I was so shocked. I shared the letter with everybody who was sitting at the table with me. I just told them. And some of them had seen the newspaper, but they did not want me to know what was being said about me. They didn't share it. So they acknowledged, some of them said, yeah, we saw it and we didn't want you to know. And I refused to go to the apartment. I said, absolutely not. I'm not going to that apartment. And somebody in the community gave me a house to live in. I paid the insurance and the utility bills, and I stayed in that house. And before I left there, I made my employer buy another house to accommodate some of the other staff who would come to live in there. So I was able to facilitate the process for others who were coming behind me. I would say the public health nurse did leave the apartment, but I did not want to go into it. I thought, no, can't do that. So I lived where this lady offered me a place to live, and I had a big house for myself.
Again, a strong leader, a person who will speak out, who will stand for the cause and for actually making things better for you and for the community and for others as well, set the path for them. So I can see as well, Bessie, I think there is Dr. Claudette Holloway as well. She raised her hand.
Please.
Yes.
Please, absolutely. President of RNAO, and I was so excited to have so many, as we said, IN leaders here. So privileged to be part of this. So please, Dr. Holloway, please go ahead.
Good afternoon, and thank you for the opportunity. There's a train going by, so if you hear some funny noises, that's what it is. But I just want to take a moment to again congratulate Dr. Angela Cooper-Brathwaite on this outstanding achievement that has been recognized by our country. She has done so much over the years. I'm so glad that through RNAO, I met Angela. If it wasn't for RNAO, I would not have met Angela. If it wasn't for RNAO, I would not have met Dr. Doris Grinspan, an advocate, an ally long before it was fashionable. If it wasn't for RNAO, I wouldn't have met Dania, the chair of our new interest group, Black Nurses for Change. Without RNAO, I would not have met Corsita. So I'm just wanting to encourage you all. I'm an internationally educated nurse, went through all the traumas we all have our own stories, but I went through those traumas too, the racism. But as Angela says, you have to press on. You have to press on and realize that you can have mentors, you can have allies that may not even look like you, but set your direction. And I wish I had as much courage as Angela. I'm learning over the years, but I encourage you, do not give up, press on. We need you. We need you in this diverse population that we live in this age when we have a healthcare system that is crumbling. Nurses are needed and INs can play a significant role. Thank you for the time.
And I need to say, don't buy it for a minute that she doesn't have the courage she has. And also to say that Angela and I would not have met, or Dania or any other here, if she would not been in RNAO, and she's our president. And bravo. Bravo, courage, another one, courage.
I said, just my last word, if I might, I said to Angela, I don't know what the process is, but I want to see you as Lieutenant Governor.
We add our voice to that.
I think you should let Manor speak. There's Manor hand raised, Rola.
Yes, please go ahead.
Okay, it won't be long because Angela, and I think, I know Angela since 2003. And I mean, I think we've been partner in crime, Angela, and we're still working together. I think I just want to add something. I know everybody has been, writing great things, but I think one of quality that Angela has, and I'm witnessing it, and I mean, I'm sorry, I'm not international. I'm from Quebec, Claudette, but anyway, I think it's the patience that Angela has and the comprehension, but I think patient with a double P, capital, because I think it's what really make her. I know she has all the other quality, but again, her patience is exemplary, and she's able to make you feel like you're not stupid. So anyway, I'm talking for myself, Angela, but I'm so glad that you got all these awards. And I mean, let's say, I think there's much more you can do, but I mean, we need to go to ICN together.
We are. And great news, I will leave the announcement for Dr. Ruth Lee about the ICN, because then we have to all get together there, because Care Center was actually lucky enough with all the great efforts and our wise leader and Dr. Ruth Lee of have submitting 5 abstracts, and we are going to be there. Dr. Ruth Lee, would you like please to say few final words?
I just cannot say thank you enough to Angela for her words of wisdom. I was not able to sleep the night when I learned about she been named to the Order of Canada. And thank you, Doris. Thank you so much to help our star shine. And it's long overdue. It takes somebody like Doris, the true leader, the fearless leader, to make it happen. So thank you so much. And everybody know that CARE Center and RNAO have a very close relationship, including every single members of CARE Center. When they enter us, they automatically have a membership with RNAO, a student membership, and now our IEN membership. We just changed it. So that is the
And that
intent.
is thanks to you, Ruth. That's your leadership. That
Because-
is your leadership.
Thank you, Doris. It's so important that we start right. We start the path right, so that we be guided by the professional organization and all the wonderful work that RNAO have done over the years. I mean, I think it took me 2 days starting this minute to name it, right? So yeah, I encourage all of you to take advantage of all the good work that RNAO have done, and Angela for sure have contributed so much to it, and of course Cadet have done so as well. And I really feel that it's time that all of us should come together, and we need to work together. And I'm so excited to hear a lot of you will be in ICN. So now we're virtual. Hopefully we can celebrate together. We are at CARE Center. We're very humble and honored that we will have 4 of our abstracts accepted for presentation. So we're absolutely very excited, and we're going to celebrate there. And we will celebrate with Angela for this great honor. And I can see many of you will be receiving orders. So Doris, a lot of work for you to do. And you probably the next recipient as well, and then Cadet and many of you. I'm so humble to see so many leaders that I really look up to. You're here with us today. So hopefully you will let your IEN colleagues know that CARE Center is here to help support them. We support them to relaunch their career in Canada, particularly in Ontario, and also every step of the way beyond. So you have a lifetime membership after you join CARE Center, and you will get linked up to the wonderful organization like RNAO and VRPN and so on. So, and many colleagues. And of course, Angela, you are an eternal friend of CARE Center. I look up to you, you know that, and I'm just so happy that we are path crossed in our career, and we could become very good friends. So thank you
Ruth,
again for.
If I can add about ICN a couple of things so people know. So Dr. Claudette Holloway, Morgan Offarth, immediate past president, and myself are leading a whole delegation. Number 1, we will sit all Ontario, all people, every time we do it, this is not new. We sit all of us together from Ontario. Rah, rah, rah.
Wow.
Rah, rah, rah. Second, there is a booth. If you have materials, Ruth, from a CARE Center, bring them. You can put them in our booth by all means. Thirdly, on the 6th, so we have 14 abstracts just from RNAO and about 30 more from other BPSOs around the world. What we have is on the 6th, the next day after ICN, we have an all day of BPSO meetings. Everybody is invited, and the media is calling me, so I need to answer because I have the phone in my.
And then Angela will be there, right? So we can.
Yes, I
get to-
3 of the abstracts I submitted. 2, I was the first author, 1 second author. So I have 3 presentations at ICN. But I want to say to the audience that Ruth was my teacher in my first year for my PhD. So I've met Ruth for many years now, and she was fabulous. Okay, so I need to acknowledge Ruth. She was in my first year, one of my teachers at UFT. Thank you so much.
Thank you, Angela. It was such an honor to have such a star in my class, and she just outshine everybody, I can tell you. And
she's still.
Yeah. So here, Angela have done so much work for nursing, nationally and internationally, and particularly for IEN, because she herself is the learning for all of us. So again, well-deserved, Angela. Very proud of you. And thank you. I cannot say thank you enough for your tremendous support for CARE Center. that you always remember the roots. You always remember the challenges being IENs, and you give back. You keep on giving back. What a role model you are. So I just hope that all of us will learn from you and really benefit from your wisdom and see you as a role model. And you have so many students and other nurses. So we just need more and more Angelas in this world. So, and she's always grooming the next generation. So I'm learning from her too. You can see that I have Rola and Bessie to have the spotlight today, because I really want people to see them as the poster girl ladies of Care Center, because this is the part of succession planning, and I know that many of the nursing leaders are doing it. So hope we will all do that. That's the only way to strengthen the profession. And I also like to take opportunity to remind everybody that tomorrow is Black History Month. So Angela, if you don't mind, we really like to ask Cadet to send some greetings of the month.
We have someone that Maureen hand that is up. I think she should be given an opportunity to ask a question.
Oh, okay. I'm so sorry, Maureen. I somehow get too excited, keep on looking at Angela's face rather than looking at the screen. My apologies. I think Bessie can ask Maureen to ask the question.
Yes, Maureen, please go ahead. We have a few minutes. Would you like to ask a question?
She's not unmuted.
Yeah.
Maureen, are you still there with us? While I wait for you to get unmuted, I just have to say how lucky I do feel as an IEN, looking up to all of you that I have here today, IEN leaders and non-IEN. This is an amazing opportunity with the support from RNAO, from Care Center. As a new IEN, I feel that there's so much room for building confidence through RNAO and through Care Center. I have to say, the journey does involve many steps, but as you said, Dr. Cooper Brathwaite, I do believe flexibility, confidence, and compassionate is something that is so necessary. And I do believe from our support programs here at Care Center, either through the mentoring program, networking, and our professional development sessions, that's what we're aiming to do as well. It has helped me, it has helped many other IENs, and we look up to all of you to try to meet some of what you have done. So thank you so much for all your work, and looking forward to meeting you again in ICN and wherever else we may be able to make some more sessions like this. I think Maureen is still there with us. Sorry, I took up a little bit too much of a time here too. Maureen, are you still there with us? Is there a question? Oh, I see something in the chat box. Most of us IENs are stuck at NNAS level. Is there a way we can be assisted? Thank you, Maureen, and sorry for any issues that you may have with the speaking with the volume, but that is the question from Maureen. Basically, the process in NNAS during the CNO registration.
So Bessie, may I answer that question, please?
For sure.
So we've been in close communication with NNAS because with all the changes. So Maureen, I hope you're one of our clients. So if that's the case, please talk to your case manager. And we are very fortunate to have Gail Waxman, who's the CEO of NNAS, come to our team meeting. My staff team meeting next Tuesday. So basically, we're gonna ask direct questions that we collect from our clients to Gail. And also, we are organizing a session, a professional development session, to have Gail as the keynote speaker. And of course, for those of you who attend, you can always ask questions directly to Gail. Yes, so please direct your concerns to your case manager, and we'll try our best to help you and direct those concerns to Gail, without naming you, and unless you wish to be named. Okay, so you will be protected. Your privacy will be protected. Thank you.
Thank you, everyone. Thank you, Ruth. Thank you, Bessie. Thank you, Dr. Angela, and all as well of our leaders, inspirational leaders today who joined the call and shared their actually celebration with all the successes and achievements of Dr. Angela. And as well, I would say you set a paradigm of leaders' perseverance and humility with all what you shared today. You shared today with us. Thank you. And I'm so happy. I'm so delighted. I was so anxious, but I was actually kind of reassured by Dr. Ruth Lee that Dr. Angela is somebody who would actually kind of take this conversation to a place of very friendly, very pleasant, very inspirational. And I'm happy that I got this opportunity. Thank you so much.
Thank you. Thanks for coming, and was my pleasure.
Pleasure is ours. Thank you.
Thank you to everyone for attending. A big thank you to our very own Dr. Ruth Lee for arranging this. A big thank you and congratulations to Dr. Cooper Brathwaite. Thank you to Rola for leading this conversation. Thank you to all the leaders here in the room for your support and your wise words today. And thank you to all the participants. Please feel free to send us any questions that you may have. I've added into the chat box our links to upcoming sessions. For those of you that are IN members and members of CARE, please reach out to your case managers. For those who are not, please reach out to our office, and we're more than willing to help support our INs follow this bright pathway ahead of us. Thank you again to all. If there's nothing else to be added, let's enjoy the nice sun that's still out there today.
Actually, Bessie, before we forget, I really like to have Cadet send us greetings on the Black History Month.
Oh, yes, thank you, Rola. So thank you, Ruth.
Thank you for the opportunity. And I just want to say, on the eve of Black History Month 2023, what a special way you have chosen to launch us in with Angela setting the trend for history to be made. We know the history of Black people and the horrors of it. We also know that anti-Black racism is still alive and well in nursing. But thanks to Dr. Angela Cooper and the committee that wrote the task report, those that have Dania with the Nurses Leading Change, Black Nurses Leading Change, we can make a difference. We are important. So we need to step up. Not everyone can be a formal leader, but we can all be a leader in some way. Lead from where you are. Thank you.
Absolutely. Thank you so much, Dr. Holloway. Thank you. I think that's the perfect way to close this today. A perfect message. Leader from where you are.
Yes.
Perfect. Enjoy the rest of your day, everyone. Thank you again, and
Thank you.
congratulations, Dr. Cooper Brathwaite.
Thank you. Bye, everyone. Have a good afternoon. Get some sunshine. The vitamin D is good for you.